Sheltering in place could be difficult for some people this long holiday weekend as restless Americans look to venture outside of their homes for Memorial Day. But park and public health officials remind people that most normal holiday weekend activities like hanging out at the beach, camping, and those big backyard barbecues are still off limits. For more on how to safely enjoy Memorial Day while practicing some social distancing, we wanted to talk to Dr. Bob Lahita. Doctor, good to see you. Let's start out with the generals. What advice do you have for people, especially those folks who decide to travel?
Well, those who travel, if you're on an airplane or you're on a train or a bus, make sure you wear your mask. When you touch things, other people, although we know now from yesterday's data that the virus doesn't live very long on boxes and on railings and on seats as long as we thought it did. So you can wash your hands when you get off the bus, plane, train, whatever, but make sure you keep yourself distanced at least 6 feet from the other person and to wear a mask at all times. I can't stress that enough. I know there are a lot of people saying, oh, it's not necessary. Well, maybe out in the open air when you're on the beach or you're in the woods hiking, it's not necessary. But when you're in a closed space with a lot of people, I would strongly advise you to wear a mask because you're at risk when they speak to you and when they sneeze on you and when they cough on you.
Dr. Lahita, let me ask you about this new publication in the medical journal, The Lancet. We've been hearing a lot about different drugs that are promising. Some of the information we're just really getting from press releases from the drug companies themselves, but having sort of a peer-reviewed article, I think, is significant. What are we to make of this news of, at least one vaccine that's starting to look promising?
Well, I think it's a very exciting news. First of all, the delivery system for this vaccine, you're not going to be injected with the virus that's been killed, as we do with influenza, or nor are you going to be injected with a live virus, which would be a disaster with regard to COVID. So what these researchers have done is gotten adenovirus 5. Now, adenovirus, we are infected with that all the time. It's the cause of the common cold, for example, or other conditions. So they take the genome of the COVID virus, place it in the adenovirus, and that becomes a carrier. And they inject you with that virus, to which you would probably make not much of an immune response. And that spike protein from the COVID virus is coded for. So it infects the cell. The cell then expresses the spike protein, and the immune system comes in and says, uh-oh, you've been injected, you've been infected with the COVID virus, and it makes an immune response. So what happens is the adenovirus infected cells go to the lymph node. The lymph node then does two things. It makes a T lymphocyte response, which is very effective. And secondly, it makes neutralizing antibodies via the B lymphocytes, which is another whole class of cells. But nevertheless, what you're doing is getting neutralizing antibody and T cells within 14 days response to the virus. And this is very, very exciting. Even though it's been done on a small number of people, I think it's really amazing. There's another vaccine out there that you did mention, and that's using messenger RNA, which again uses the genome of the COVID virus. This is all 21st century basic molecular biology, which has come to our aid with regard to this disease. And it's very, very exciting. Everybody should be really, really full of hope that the vaccine is going to come out in the early fall, maybe early winter at the latest.
Dr. Bob, I want to ask you about a new CDC estimate that says 35% of coronavirus patients do not have symptoms. We've talked about this in the past, that you can be asymptomatic. A lot of people who are choosing not to wear masks, a lot of people who are choosing not to social distance, and they say, well, I'm young, I'm healthy, I can survive this if I get it. But the question, of course, becomes for the people that they interact with, especially around a holiday when presumably those folks who decide to venture out of their apartment or their house will be interacting with other family members. So what kind of dangers does that pose going into Memorial Day?
That poses a lot of danger, Vlad. It really does, because young people think that they're invincible. We all know that as parents, etc. But you've got to understand that there are people out there that are asymptomatic. They have no symptoms, no muscle aches, no shortness of breath, no fever, and they're carrying this virus. And when they talk to you, as I'm talking to you, if you were 3 feet away from me, I could give you this infection. I don't have any symptoms, but you'll come down with an acute condition of muscle aches, fever, respiratory problems, etc. And that's a really big deal. So you really have to worry about asymptomatic people. And that's why I'm advising, as is Tony Fauci, that everybody wear a mask. Because if you wear a mask, it's not a surefire thing unless you have an N95. But in the hospital, we wear N95s to protect us from the patients and the patients from us. In public, you should wear a cloth mask at the least to prevent droplets from infecting somebody else. Even if I don't have symptoms, I can give that disease to you. And that's the really, really worrisome part of this whole condition, this whole syndrome.
All right, Dr. Lahita, thank you so much.
Thank you.